Hello and welcome to the ASCO Guidelines podcast, one of ASCO's podcasts delivering timely information to keep you up to date on the latest changes, challenges, and advances in oncology. You can find all the shows, including this one, at asco.org/podcasts. My name is Brittany Harvey, and today I am joined by Dr. Navneet Singh from Postgraduate Institute of Medical Education and Research in Chandigarh, India, co-chair on therapy for stage 4 non-small cell lung cancer with driver alterations, ASCO Living Guideline version 2023.2. Thank you for being here, Dr. Singh.
Thank you for having me, Britt.
Before we discuss this guideline, I'd like to note that ASCO takes great care in the development of its guidelines and ensuring that the ASCO conflict of interest policy is followed for each guideline. The disclosures of potential conflicts of interest for the guideline panel, including Dr. Singh, who has joined us here today, are available online with the publication of the guideline in the Journal of Clinical Oncology, which is linked in the show notes. So then to dive into this living clinical practice guideline, Dr. Singh, this living guideline for systemic therapy for stage 4 non-small cell lung cancer with driver alterations is being routinely updated. What new studies were reviewed by the panel to prompt an update to the recommendations in this version?
So for this 2023 version 2 update, 3 trials were included. These include 2 studies which involved patients with exon 20 insertion mutations who had received prior platinum-based chemotherapy and subsequently were treated with either amivantamab in the Chrysalis trial or with mobocertinib in the Exclaim trial. The third trial, which formed the basis for this update, was one which involved patients with KRAS G12C mutation who had previously received systemic therapy and subsequently were treated with sotorasib, and this was the CodeBreak 200 trial.
Understood. So then based on these 3 new trials that you've just mentioned, what are the updated recommendations from the expert panel for patients with advanced non-small cell lung cancer?
For patients with advanced NSCLC with an EGFR exon 20 insertion mutation and an ECOG performance status of 0 to 2 who have received prior platinum-based chemotherapy, clinicians may offer amivantamab or mobocertinib as monotherapy. It is important to mention here that in the absence of head-to-head comparison of amivantamab or mobocertinib with each other or with other standard second-line therapies, no recommendation for sequencing can be made, and therefore treatment should be individualized. Now, use of either of the 2 drugs is based on low-quality evidence and has a weak strength of recommendation. And the update for treating KRAS G12C mutated NSCLC is largely similar, that patients who have received prior systemic therapy may be offered sotorasib.
Thank you for reviewing those updated recommendations. So what should clinicians know as they implement these new recommendations, and how do they interface with the existing recommendations?
It is important for clinicians involved in the management of EGFR mutant lung cancer to realize that exon 20 insertions are the 3rd most common group of EGFR mutations and comprise approximately 5% of all EGFR mutations. Now, historically, the EGFR targeted drugs, which have been the 1st, 2nd, or 3rd generation tyrosine kinase inhibitors, have largely shown efficacy for the 2 common type of EGFR mutations, namely the exon 19 deletions and the exon 21 L858R point mutation. Exon 20 insertion mutations thus did not have any effective targeted therapy so far. But now both of these drugs, amivantamab and mobocertinib, have shown very promising results for pre-treated patients with this molecular aberration and therefore may be used in lieu of standard second-line therapy. Similarly, in the case of KRAS G12C mutation, before this there was no effective targeted therapy, but now sotorasib based on the CodeBreak 200 trial appears to be a very valid option in lieu of standard second-line therapy.
Excellent. So then what do these new treatment options mean for patients with stage 4 non-small cell lung cancer and an exon 20 insertion or a KRAS G12C mutation?
For patients with stage 4 NSCLC and harboring an EGFR exon 20 insertion, availability of 2 specific targeted drugs will improve the treatment options available following standard first-line therapy. Furthermore, ongoing trials for these agents in the treatment-naive setting may eventually lead to a scenario wherein such patients may be treated upfront with targeted therapy rather than chemotherapy or chemoimmunotherapy, analogous to how patients with the common EGFR mutations are treated. The ultimate aim of precision medicine is to offer the most effective treatment based on biomarker expression and targeted therapies in comparison to chemotherapy, because these lead to better treatment outcomes and lesser side effects.
Absolutely. The goal of better outcomes with less side effects is what we're looking to achieve here. So then finally, as this is a living guideline, what emerging therapies or targets is the panel monitoring for future guideline updates?
As already said, the expert panel eagerly awaits data from ongoing trials which are assessing the efficacy of drugs targeting the EGFR exon 20 insertion mutations, namely amivantamab and mobocertinib as first-line therapy, as also the drugs which target the KRAS G12C mutations, which is sotorasib and adagrasib in the treatment-naive setting. Ultimately, the optimal sequencing of therapies needs to be established in advanced and metastatic non-small cell lung cancer for several of the oncogenic driver alterations other than classical EGFR mutations and ALK and ROS1 rearrangements. These include the EGFR exon 20 insertions and other uncommon EGFR mutations, the BRAF V600E, KRAS G12C, the HER2, and the MET exon 14 skipping mutations, as well as the RET and NTRK fusions.
It sounds like the Living Guideline expert panel will be busy moving forward then. So I want to thank you so much for your work to update this Living Guideline. And thank you for your time today, Dr. Singh.
Thank you so much. It was a pleasure being here.
And thank you to all of our listeners for tuning in to the ASCO Guidelines podcast. To read the full guideline, go to www.asco.org/living-guidelines. You can also find many of our guidelines and interactive resources in the free ASCO Guidelines app, available in the Apple App Store or the Google Play Store. If you have enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.